All right, so let's look at Flumazenil. Initial dose is 0.2 milligrams. Administration techniques, initially 0.2 milligrams IV over 15 seconds. If patient does not react desired level of consciousness after 45 seconds, what are you going to do? You're going to give it again, and you're going to give it up till you get to 1 milligram. So here's the table for that. Makes it easy. Now, if, 6 to 10 minutes, about 80% of the maximum response is seen within 3 minutes. Call anesthesia if the desired clinical response with administration of the initial 1 milligram dose. So you're going to go back and you're going to give it another dose, let's see, every 15 seconds. For how many doses? First dose is 0.2 milligrams, so you're going to get 5 total dosages. If they don't respond in those 5 doses, what do you do?
Call anesthesia.
Well, if you're like Valerie, or somebody don't have anesthesia, what do you do? Yeah, you got to start thinking about how you're going to ship them to somewhere somebody can take care of them. Or if they're still breathing good, you're not having any problems, then what are you going to do? You just got, maybe all you need to do is just let it wear itself out because it's fairly close, okay? So look at it from that point of view. Reversal of benzodiazepines, potential adverse response. Now this is what you got to worry about. You can cause nausea, they can start vomiting, sweating, and if you're having to breathe for them and you give them this and they've not started breathing on their own yet and you're trying to breathe them with a bag valve mask and they're puking on you, it's not a fun thing. They get hot flashes, agitation, headaches, injection site pain. It says here, do not use Flumazenil in patients who chronically take benzodiazepines. So who would chronically take benzodiazepines?
Every other patient you get.
That person that's on that little yellow Valium pill every day, Oh man, I'm good to go today. You come in here, give them this, and all of a sudden they're bouncing off the walls because you've undone all that stuff they've been taking care of all these years.
That's like giving Narcan pretty much.
Oh yeah. Same rules. Okay. So what else may happen? They may get tremors. They may have profuse sweating. They may have hypotension from this drug, and they may even cause them to have seizures. So if they are on seizure medications, another person you don't want to give the reversal to. So those are things to think. If it's a lot better to let it wear off, as long as they're breathing, and as long as you maintain stable vital signs in breathing, it's better just to work with them and let it wear off instead of getting in a hurry and just giving them that drug.